Usabukele iKids News siphinde sikwamukele. Njengoba siphuthule inyanga kaMfumfu izolo singelibale ukubaleka kwamehlo ombukeli. Inyanga yokuqashisa ngokunakekela kwamehlo igujwaze ngama-21 kuMandulo kuze kube ziyisishiyagalombili kuMfumfu ukuze kuqashiswe ngokubaleka kwempilo yamehlo ukuze sigweme ukugcina singaboni sidalo. Nangu umbiko ugcwele ulandela mayelana nalesitho somzimba esibaluleke kangaka.
Amehlo abalulekile empilweni yomuntu. Ungabona nje indilinga ezimbili uzithathe kancane, kodwa ke amehlo abalulekile ngoba phela yiwona phela esibona ngawo. Kodwa ke mbukeli, uthi ubuwazi ukuthi amehlo wakho ayakwazi ukubona u200 degrees of your surroundings without you turning your head. Lokho phela kuchaza ukuthi amehlo wakho ayakwazi ukujika abuke emaceleni ngo200 degrees ngaphandle kokuba wena uphendula ikhanda lakho ujeqeze ngancane. Izinkinga zamehlo ke ezijwayele ukuhlasela izingane yilezi: i-amblyopia, i-cortical visual impairment, developmental abnormalities, nokuyinkinga phela ezivela uma umuntu ezalwa, i-double vision kanye ne-genetic eye disease kanye nezinye. Ngokuya ngenhlangano yezempilo kaMhlabuhlangene i-World Health Organization babalelwa ku-2.2 billion abantu abanezinkinga zamehlo emhlabeni wonke jikelele. Kubikwa ukuthi iningi labantu abangaboni emehlweni baneminyaka engaphezulu kuka-50. Kodwa ke nezingane ezingaboni emehlweni zikhona nazo emhlabeni wonke jikelele.
Ingabe mbukeli kubaluleke kangakanani ukunakekela amehlo ethu njengezingane ezisakhula? Sikubuzile ke wabe usuphendula kanjena.
Amehlo ami ngiwanakekela ngokuthi ngingawathinti ngezandla ezingcolile, ngigweme ukuhlala elangeni, ngingahlali phambi kwe-TV isikhathi eside noma phambi kwamafoni.
Ukubuka enye yemizwa ebaluleke kakhulu emzimbeni womuntu. Ingakho kumele siqikelele ngayo yonke indlela ukuthi siyawanakekela amehlo ethu. Kanje ngokugwema ukuthinta amehlo ethu ngezandla ezingcolileyo, ukugwema ukubuka into ekhanyayo isikhathi eside, into ekhanyayo enjengoma TV, computers, ama-laptop nama-cellphones wethu. Ukuphuza amanzi kuyasiza kakhulu ukuthi kugcine amehlo ethu emanzi futhi engazizwa ecindezelekile. Nokudla ukudla okubalulekile okunomsoco kanjengamaqanda, ukherothi, ispinashi nemfino. Ukunakekela amehlo ethu kusiza ekutheni kusinciphisele amathuba noma ngithi kusiza ekutheni kusivikele ezifeni zamehlo.
Ukudingida kabanzi ngalolu daba namhlanje lapha ezindlini zethu zokusakaza sivakashelwe udokotela wamehlo uDr. Antonel Delaray ofundisa eNyuvesi yaseGoli eUJ Mbukeli. Ake sixoxisane naye ke sizwe kabanzi ngalolu daba olumqoka kangaka. Good morning and welcome to Kids News, Doctor. How are you?
Good morning, Sikle. I'm fine, thank you.
I'm fine. We are happy to have you on the show in the morning. Let's just get into it. Can you please tell us what are eyes as body organs? What do they do in the body? And in the simplest form that our viewer can understand.
Well, eyes are a very important sensory organ. It helps us to see. So it's important for reading, writing, and of course, being functional around the world with us. So this is an eye that I've brought with, and you can see it's got its own muscle system, so it can move around and look around. And then it's got a focusing system, so that we can see from far to near to make us work at school properly and be able to read properly.
And what is a good sight or a good vision?
A good sight. We talk about, I don't know if you heard about 6/6 vision. The Americans talk about 20/20 vision. That means that you can see clear. But there's much more about seeing good. We want us to see clear at near, focus. Our eyes must move together. We must not see double. We must see everything nice and single. So there's much more to just seeing than just seeing clear.
Talking about seeing double, I believe that could be in eye problems. What are some of the eye problems that are actually associated with kids or more common in kids who are actually still growing, and how do they affect them?
Well, there's a lot of eye problems that can affect kids, especially now with children working the whole day on their iPads and cell phones that can affect vision. One of the biggest symptoms is when one of the eyes are starting turning in and they experience double vision. Parents must also look out for teary vision and eyes that's red. Children who feel that their eyes can't focus from far to near should go and visit an optometrist because it's important to sort out the problem before it gets worse.
Generally, we are told to take care of our skin and have a good oral eye hygiene. But how can we take care of our eyes? And is this actually being preached enough?
I don't think it's preached enough. We need to go for regular eye exams, like we go for dental appointments and other appointments. We must go at least once a year to have our eyesight checked out. Not just to make sure we see clearly, but to make sure our eyes are healthy on the inside. And then, of course, if we work the whole day on computers and tablets, we need to take regular eye breaks because otherwise we put too much strain on our eyes and that can cause damage on the long term.
Speaking about computer and tablets, my next question was about to ask, what is the moderate amount of time that one can spend in front of a computer or a tablet or actually watching TV? Is there a moderate amount of time?
You know, these days school demand us to do research on the internet and to spend time on our e-devices. The general rule that we use is after 20 minutes you have to take at least a 20-second break. When we say a 20-second break, we say you need to look at something in the distance. You need to look far and you need to blink your eyes a few times. So after 20 minutes, definitely a 20-second break, and we say don't spend more than 2 hours a day on your cell phone or on your tablet or in front of your computer. Go and play outside.
Unfortunately, most kids are born with eyesight problems, but then this is not actually detected at birth. What our parents can actually look for in this situation?
Well, as I said before, it's important to look for eyes that turns in or out. The eye that doesn't look nicely aligned is important. Or if there's a funny reflex, like a white reflex coming from the eye, then parents should go for follow-up visits as soon as possible.
So are these eyesight problems that are associated with sight and seeing, are they actually curable?
Some of the eye problems, for instance, problems that's inherited, is not necessarily curable, but it can be treated, especially if it's detected earlier. So with glasses, with surgery, with therapeutic drops, or maybe sometimes visual therapy, it can be resolved. Unfortunately, not all the eye problems are curable, but as I say, there's a lot of technology to reduce the symptoms or make the symptoms reduce the symptoms, yes.
You spoke about glasses. What is actually the correct age or the minimum age where a kid can start actually wearing glasses and understand why they're wearing glasses?
You know, there's not a right age. Sometimes little babies, infants need glasses, but if it's not necessary, of course, we won't prescribe it. Sometimes children need glasses as they get older. We always say before you go to grade 1, it's important to have your eyes tested. If you need glasses, that would be the right time to get glasses. And then, unfortunately, if you get older, you'll definitely need the glasses to read and see near. But contact lenses are also an option. These days, we fit even babies with contact lenses if it is necessary.
Okay. Unfortunately, we have ran out of time. Thank you so much for joining us on the show this morning. And I hope our viewers are going to learn how to take care of their eyes. And then our parents as well will start checking their kids if ever they have eye problems. Thank you so much.
Thank you, Sihle. It was a pleasure. Thank you.
Umgodla wethu awukapheli mbukeli ake siphinde futhi sihlabe ikhefula ehlelweni siyabuya nezinye indaba ungaphuthelwa.